Dr. Ian Brighthope, a nutritional and environmental medicine specialist familiar with the power of high-dose vitamin C, summarized it best in the 60 Minutes documentary. Quote, "People are dying because of the attitude of the medical profession." End quote. Some medical treatments are downright barbaric. Since the discovery of penicillin, many antibiotics have been added to the arsenal of chemical agents doctors deploy against bacterial infections. But, for a number of reasons, many strains of bacteria are totally unaffected by them. Even now, pharmaceutical companies are losing the race to develop antibiotics that are effective against increasingly drug-resistant bacteria. In 2008, Dr. Kenneth Todar, bacteriologist, helped identify the enormity of this growing problem. Quote, "Nowadays, about 70% of the bacteria that cause infections in hospitals are resistant to at least one of the drugs most commonly used for treatment. Some organisms are resistant to all approved antibiotics and can only be treated with experimental and potentially toxic drugs." End quote. So what happens in a traditional medical environment when a patient develops a raging antibiotic-resistant infection? The answer depends on where the infection is. If it's in an organ, barring a miracle, the patient dies. But if the uncontrollable infection is isolated in a limb, there's a more effective therapy: amputation. In most, if not all cases, this is unnecessary. The late Maureen Kennedy Salomon, president of the National Health Federation, tells of a frightening experience with her husband, Frank. During an attempt to bathe Sam, their pet cat, the feline became more than excited at the sound and feel of a hairdryer. Sam bit into the bone of her husband's right index finger. An emergency room doctor checked the bite, administered a tetanus shot, and prescribed an antibiotic. During the next 4 days, Frank's right hand swelled to twice its normal size, became discolored, and caused him intolerable pain that medication could not quell. Doctors at the emergency hospital were unanimous in their diagnosis: osteomyelitis, infection of the bone. In Maureen Salomon's words, quote, "The bacteria had eaten away the bone, the joint, and the knuckle, and continued to travel down the hand. The laboratories were unable to identify the bacteria. Grim-faced doctors told me it would most probably cost Frank his hand, and possibly his life. He was put on intravenous antibiotics around the clock. His hand was slashed open across the palm and down both sides of the finger to the bone, and washed every 2 hours in an attempt to stop the raging infection. I went before the hospital board to try to get vitamin C administered to him intravenously. I was told that they were sure it was a good treatment, but they knew nothing about it, and they did not allow treatments of which they had no knowledge." End quote. After 5 weeks of this ineffective therapy, the Salomons were told there was only one way to save Frank's life: amputation. Through consultation with Robert Cathcart, MD, a vitamin C expert, they decided to leave the hospital and treat the infection with high-dose vitamin C. Doctors inside and outside the hospital counseled them that their decision would probably cost Frank his life. Nevertheless, in anticipation of things continuing to worsen, the surgical appointment for amputation was allowed to stand. The Salomons drove from the hospital directly to a local clinic that routinely administered high-dose vitamin C. Immediately, the doctor started an intravenous infusion of vitamin C, giving Frank 60 to 75 grams per day via this route. Frank was also taking 30 grams of oral vitamin C per day and packing a poultice of garlic and red clay on his hand each night. Within 2 treatments, the pain, which had been requiring 2 codeine tablets every 4 hours, stopped. After 9 days of treatment, the infection and the swelling were totally gone. The deep open wounds from the surgery had healed with only hairline scars left as a reminder. Again, in Maureen Salomon's words, quote, "Frank kept his appointment for the planned amputation. With a broad smile, he held out a no longer misshapen or discolored right hand to shake the hand of a very shaken surgeon. They had never seen this happen before. 1 in a million, they said. As I watched their shocked faces, a scripture verse came to mind. God has chosen the simple things of the world to confound the wise." End quote. Perhaps more alarming than the case just recounted is the pandemic of a related problem, sepsis. Commonly called blood poisoning, sepsis occurs as a result of the body's inability to cope with a microbial infection as well as the toxins generated by the infection. Even though 7 in 10 adults have never heard of sepsis, it claims the lives of 1 American every 2.5 minutes. Other victims of sepsis are saved through amputation. Thousands of studies support the fact that high-dose vitamin C is a broad-spectrum antimicrobial, Resource H, and that it neutralizes all toxins, Chapter 2 in Resource H. Every day, high-dose vitamin C could be saving the lives of sepsis victims. Every day, countless fingers, toes, hands, feet, arms, and legs could remain attached and healthy if the medical community would simply hear and respond to the facts with scientific integrity. Vitamin C can cure viral infections. Vitamin C has been shown to prevent, put into remission, and even cure many viral infections. See Resource H for details. Here's a partial listing: AIDS, HIV, Ebola, encephalitis, hepatitis, herpes, pneumonia, polio, shingles, swine flu. On the other hand, drug companies have yet to develop any drugs that will reliably kill viruses. Instead, vaccination is modern medicine's answer to viral infections. Without delving into the controversies surrounding vaccination, this strategy is not without significant health risks. In addition, many viruses, such as those causing influenza, can evolve into new strains that are unaffected by the antibodies that were developed in response to a previous vaccination. For example, this year's flu vaccination, which was created from last year's virus, may have little or no effect against the flu virus currently making the rounds. Given the fact that modern medicine has no effective therapy for all viral and many bacterial infectious diseases, why aren't doctors turning to high-dose vitamin C to save the lives of their patients? For decades, men in high places of influence have tried to keep the knowledge of high-dose vitamin C locked away. When that has not worked, they have tried to discredit it. Here's where it all started. Modern medicine's scorn for high-dose vitamin C, the beginning. Most Americans under the age of 30 know little, if anything, about polio. Thankfully, it rarely occurs any longer in the United States. During the late 1940s and early 1950s, however, it rose to epidemic proportions. Many of the polio victims, fortunate enough to survive the acute infection, spent the remainder of their lives crippled. Polio devastated the lives of many patients and families. Polio was one of the first viral diseases treated with high-dose vitamin C. The clinical results were awe-inspiring, and the response of the medical community was totally dumbfounding. On June 10, 1949, in Atlantic City, New Jersey, Frederick Klenner, M.D., presented a summarization of his polio work at the annual session of the American Medical Association, AMA. At that time, he had cured 60 out of 60 cases of polio with high-dose injectable vitamin C. He made the following remarks. Quote, "It might be interesting to learn how poliomyelitis was treated in Reidsville, North Carolina during the 1948 epidemic. In the past 7 years, virus infections have been treated and cured in a period of 72 hours by the employment of massive frequent injections of ascorbic acid, or vitamin C. I believe that if vitamin C in these massive doses, 6,000 to 20,000 milligrams in a 24-hour period, is given to these patients with poliomyelitis, none will be paralyzed, and there will be no further maiming or epidemics of poliomyelitis." Note, these doses were used on infants and small children, equating into doses well in excess of 100 grams daily for an adult.